Good morning, Trinidad and Tobago. The pleasure is once again mine to welcome you to the Ministry of Health's COVID-19 update for Monday, 9th August 2021. Your presenters for today's updates are Dr. Miriam Abdul-Richards, Principal Medical Officer, Institutions, and Dr. Adish Surjusing, Director in the Directorate of Women's Health. I am Al Alexander, Senior Corporate Communications Officer at the Ministry of Health. We begin with Dr. Richards, who will present the latest clinical, vaccination, and hospital occupancy updates. Dr. Richards.
Thank you very much, Al. Good morning to Dr. Adish Surjusing. Good morning to all members of the media who have tuned in, and good morning to the viewing and listening population of Trinidad and Tobago. Thank you once again for joining us for our weekly press conference. I'd like to present the clinical statistics as per media release 810, which is dated at 4 p.m. of the 8th of August 2021. There were an additional 129 positive cases reported in the last 24 hours. This has taken the total number of active positive cases to 5,922. These cases are distributed as follows: 5,399 persons in home self-isolation being monitored by the County Medical Officer of Health for their area. 159 persons in state quarantine, 79 patients in step-down facilities, and 315 patients in the 9 hospitals in the parallel healthcare system. As of 4 p.m. yesterday, there were 417 and 70 persons fully vaccinated with the first dose. The number of persons fully vaccinated with the second dose is at 228,175. We would like to thank the population thus far for their high levels of vaccine acceptancy and encourage persons who have not been vaccinated to please seek vaccination at one of the 109 health centers or 6 RHA-run mass vaccination sites, or the 6 mass vaccination sites that are being run in partnership with the private sector. I'd like to now present the clinical status update on the 16 facilities within the parallel healthcare system. At present, there are 1,022 beds in the parallel healthcare system, and this is spread between Trinidad and Tobago, with 14 facilities in Trinidad, 2 hospitals in Tobago, and divided as follows: 9 hospitals for severely and critically ill patients and 7 step-down facilities for recovering patients. The rolling average, which is the average number of cases per day over the last 7 days, is currently at 185, taking the 129 new positive cases from yesterday into account. The rolling average has been constant between the last 2 days, 185 versus 186, and provides a predictor as to the number of beds we would need in the next 3 to 5 days. Next slide, please. As you would notice, the gap between the admissions, which is the yellow or orange line, and green, the discharge line, continues to be narrow over the last 2 days or so, and this represents a decreased burden on the system because it shows that less additional persons are being added into the system requiring care. As of yesterday, the number of net admissions was 1. If we look at the total number of admissions and discharges per week, considering that the week has started, and this would be in the following slide, as of today, we would notice that the gap between admissions and discharges is very narrow. And as the slide would demonstrate, next slide please. Yes, thank you. The slide would demonstrate that it's a very close margin, and we hope that over the coming week this margin continues to be narrow. When we examined the next slide, so that's a admission net of 1 additional patient, as I indicated. Next slide. When we look at the total number of actual COVID positive patients hospitalized in the parallel healthcare system, we would notice that since the 15th of July or so, we have noticed a plateau in the actual number of patients within the system. This is an important indicator because it does not take into account the increased number of facilities, and so it gives us an indication of the actual burden on the system. And as of today, and this will be documented in the media release at 4 p.m. 811, there are 382 persons within the parallel healthcare system divided by the hospitals versus step-down facilities. We continue to notice a 3-to-1 and 4-to-1 ratio of severely and critically ill patients versus those recovering. Next. The overall percentage occupancy, which takes into account Trinidad and Tobago, is currently at 37%. And if we break this down, Trinidad is at 38% and Tobago at 34%. That is 4 out of 10 beds within the system are currently occupied. Next. This, of course, represents the breakdown, and we would see that Trinidad and Tobago now have more or less become equal in terms of the occupancy levels. Tobago at 34%, Trinidad at 38%. Next. We also examine the percentage occupancy, and this really is an indicator to allow us to understand or to predict the capacity of the hospitals that treat the severely and critically ill patients, given an intended or given a prediction of increased cases or projection. The trend continues to be consistent in that 7 or 8 out of the 9 hospitals in the parallel healthcare system and 6 out of 7 in Trinidad continue to be under the critical level of 75%, while all 7 step-down facilities are under the 75% threshold. Next. When we look at the breakdown of ward occupancy, which deals with the management or clinical management of the less ill patients versus the high dependency unit, which is of course a step up, and the intensive care unit, which deals the overall ward occupancy is at 35%. Again, it mirrors the total occupancy, so we can say that 4 out of 10 beds on the wards are currently occupied. The ICU percentages this morning overall at 64%, and the high dependency unit is at 43%. We again would notice that the occupancy levels in the ICU and HDU continue to be on the high side because the average ICU occupancy over the last month is at 80%, while the high dependency unit occupancy is at 67%. That's the average. Next. One of the roles of the parallel healthcare system is to protect the traditional healthcare system, that is the RHA system. And we often look at the number of patients that are awaiting transfers from the accident and emergencies in the traditional healthcare system, and across 10 accident emergencies in Trinidad and Tobago. This morning, we again continue to notice a consistent trend with a low number of patients in the traditional healthcare systems. Throughout our A&Es this morning, we have 5 patients at the NCRHA accident and emergencies, 3 at the SWRHA sites, 3 at the ERHA sites, and 3 at the Northwest RHA sites. This brings to an end my update on the clinical statistics in the parallel healthcare system and a breakdown of media release 810. In closing, I would like to encourage all persons to please be vaccinated, and if you received your first vaccine, please ensure that you receive your second vaccine within the time frame. Vaccines are safe, they are available, and they are accessible throughout Trinidad and Tobago. And in addition to following the public health regulations and the 3 W's, wear your mask, wash your hands, and watch your distance, vaccines are our ammunition against the COVID-19 virus. Thank you once again for adhering to these guidelines, the regulations, and for your high acceptance of the vaccines that have been provided. And I now pass over to Al to continue.
Thank you very much, Dr. Richards. I'm pleased to welcome back Dr. Adish Seju Singh. I recall on his last appearance at this program, it was announced that it was now safe for breastfeeding women to take the Sinopharm vaccine. Some of those mothers who took the vaccine at that point are now fully vaccinated. I want to invite Dr. Surjit Singh to update us on their progress and other issues surrounding COVID-19 and women's health. Dr. Surjit Singh.
Thank you, Mr. Alexander, and good morning to my colleague, Dr. Mariam Abdul Richards. Good morning to all viewing and listening members of the public and to members of the media. So, my name is Dr. Adesh Surjit Singh, and I'm the Director of Women's Health, and our unit is responsible for improving the health care and the improvements to maternal and newborn health in Trinidad and Tobago. So today I'd like to start with a few slides detailing some statistics, which I always do, and this is my first slide here. I'd just like to describe the slide. It's a little difficult. I know some of you want to see all the details in the slide, but on this slide I actually have the monthly trends in Trinidad and Tobago with respect to the total births, which we analyze at the Ministry of Health. Our data is up to date up to July, so we have all the data up to July of 2021 reflected on this chart. What this does is help us to, in terms of the need for services, in terms of prediction of services, to allocate resources. That's what we do at the Ministry of Health. We put policies and things in place to ensure the protection of our mothers and newborn. What this graph actually shows, the lowest line, which is a purple, dark purple colored, for the year July 2021, shows that generally the trend continues, that we are seeing less births as each year goes on. The highest line on this graph is actually for 2018, and you can see that each successive line is slightly lower as we move along. What this shows so far for us is that we haven't seen any increased numbers of births as a result of COVID, and we continue to monitor this very closely. Next slide, please. So in terms of what has been happening for your maternity and newborn services, and this is important, and Dr. Richards would have said this, we have been able, with the parallel healthcare system, to protect our maternity and newborn services. This is something that hasn't been happening worldwide. In Trinidad and Tobago, as a result of the things that have been put in place with the parallel healthcare system, we have been able to continue a safe environment for our mothers and newborn babies. In our hospitals, we have been able to set up special areas for COVID-19 positive women for emergencies or those who also require delivery. For those in the quarantine facilities, we set up telemedicine services, as well as for those who are quarantined at home, we can monitor you safely. In addition, Trinidad and Tobago we are proud, in a proud position. We have maintained our targets, which are set for the Sustainable Development Goals of 2030 for maternal and newborn morbidity and mortality. And here I just need to make a plea. All our antenatal services are available at the health centers, at our public health hospitals, and in private sector. Please attend your physical antenatal visits. You need blood tests, ultrasounds. All of these services are up and running. Next slide, please. So, the last time I was here, which I believe was about a month and a half ago, I had stated that we had in our database 170 pregnant women. As of today, this is today's update, we have 285 pregnant women who have contracted COVID-19. They have all been in various stages of pregnancy. You'll appreciate some have not yet delivered. Some have become critically ill, going to our high dependency unit and intensive care unit. And unfortunately, I have this sad news to report that within the recent past, we actually lost our first mother after she delivered to COVID-19 in Trinidad and Tobago as a result of the complications of COVID-19. So we have reached that place which is being seen worldwide, where maternal deaths are being reported. Next slide, please. Some of the pregnancy on the whole is now considered a higher risk situation, and some additional risks include if you're over 35 years of age, if you have those comorbid conditions, diabetes, high blood pressure, obesity, asthma. If you're in the second half of pregnancy, these patients are more likely to be admitted to hospital, go to the intensive care, and experience both morbidity and mortality, as unfortunately we have experienced in Trinidad. Next slide, please. How does the virus affect, what does it do to pregnancy? As you've heard before, some viruses can cross the placenta and can cause harm to the fetus. In this case, so far, we have not seen any direct fetal effect or any fetal anomalies, and transmission to the baby is very rare but reported in the scientific literature. So on another sad note, we have had a case where a mother has transmitted COVID, so she is COVID positive, and because of our meticulous screening procedures at hospital, where we do screen our pregnant patients when they come in for delivery, we picked up that she was COVID positive. Luckily, she was asymptomatic, and then we checked the babies, and in this case, this baby has turned up to be positive. So this is the first case of documented mother-to-child transmission of COVID-19 in Trinidad and Tobago, and is the youngest patient we have to report. At this time, the case is ongoing. I'm not allowed to share too much clinical details, but I would like to say that both mother and baby are doing well and being monitored by the health care professionals. With respect to pregnancy itself, COVID-19 increases your risk of preterm delivery, increases your risk of hospitalization, and may have a possible heart complication as a result of COVID itself acting on the heart. Breastfeeding remains safe and highly recommended even if you are COVID positive, and you will be guided by your healthcare professionals. Next slide, please. So, as Mr. Alexander has said, when I was last here, I did specify that breastfeeding for breastfeeding population, the Sinopharm vaccine specifically is allowed to be used in patients who are getting access to the vaccine and happen to be breastfeeding. And I'm pleased to report that many women have taken up this opportunity, and we have had no problems in those patients who have been taking the vaccine, and quite a few are now fully vaccinated, having reached to the 3 weeks they've got their second dose, and some have actually gone 5 weeks, so they have had that additional 2 weeks to consider themselves fully vaccinated. You've heard here reasons. We've had one maternal death, we've had one baby with getting the transmission, and you have 270 plus cases now of women who are pregnant who have gotten COVID. And these are reasons why I'm asking the general population to get vaccinated. These are the vulnerable persons that we talk about every time. They cannot be vaccinated. You, if you are living with your pregnant patients in the same household, for example, please take the opportunity to go get vaccinated now if you haven't done so. Our pregnant women and our children as well, under the age of 18, deserve adults to make adult decisions. Please also continue to follow all public health measures. Thank you very much.
Doc, before you go, we normally receive some questions, frequently asked questions, and specifically about women's health. And so I'd like to pose some of those questions to you this morning. The first is, what advice would you give to a woman who had a first dose of a COVID-19 vaccine and then discovered that she was pregnant?
Right, okay, thank you, Mr. Alexander. So actually this is a real-life scenario. This is happening now. Of course, some persons are taking the vaccine, which is excellent, but then subsequently discovering that they are pregnant. So my advice to them right now, because we, at this point in time in Trinidad and Tobago, we aren't allowing our pregnant women to receive the vaccine. So you've had the first dose, you will not be able to get your second dose. However, I want to reassure you, the safety of the vaccine is there. Inherently, it's safe, but we are not actively going out to vaccinate this population. So after the pregnancy, we can do some catch-up, and whatever prevails at that time, as the scientific information is updated, we will update the information.
Okay. Second question. For women on certain contraceptives, where there's a slight risk of getting a blood clot, can she take a vaccine with additional slight risk of developing a blood clot, or should she stop her contraceptive?
Right, and again, another excellent question, Al. So we are getting this question, and in fact, many healthcare professionals are not so certain what to advise these patients. We've said before that there is a very small risk of this syndrome associated with blood thinning as well as a blood clot, thrombocytopenia, thrombosis. And it's very rare, very uncertain as to the profile of those patients. So patients who are on effective contraception should never stop their contraception in order to take the vaccine, because pregnancy is actually, you are at much higher risk of getting a blood clot than the risk from a blood clot in using the vaccine.
Okay. Thirdly, does the vaccine affect a woman's fertility?
Right. So again, this is another question that abounds on social misinformation platforms. And the answer is, in no way does the vaccine affect a woman's fertility. In fact, I've said it before, if a man contracts COVID-19, in some centers they are seeing that it can affect the sperm counts. So that's a problem that's being seen now, where males' fertility could be affected by getting by the COVID-19.
Okay. Should women wait for another version of the vaccine that might be coming to Trinidad and Tobago? For example, mRNA types like Pfizer, BioNTech? Or should she take the ones that are here right now?
Right. So this is actually a question that many persons are asking.
Mm-hmm.
And we have said it before. What is available to us right now, whichever vaccine you get access to, should be the one that we need to put into your arms. We need to protect us right now, whichever vaccine is available. We need to get our vaccination rates up so that we can at least have some sort of initial protection to our population, and that holds for all women.
And you know that the talk now is on variants, the Delta variants. How can women prepare for the possibility of the various variants that they may be associated with increased rates of spread of the virus?
Right. So that's another good question, and this holds again for all, because at the end of the day, we're trying to protect our vulnerable population, these pregnant women, all women in general, or children. We don't wait for these things to reach to our shores. We know and we see worldwide what's happening. These variants are associated with a higher degree of spread, and therefore more persons ending up in the hospital and overwhelming our resources. You need to take its layers. Take the vaccines that are available now and follow all of the public health measures as layers to help prevent us getting COVID-19.
Yes. And finally, will vaccines be offered to pregnant women in Trinidad and Tobago?
Right. So this is another question that's very common as well. And well, worldwide, the WHO, the World Health Organization, has said that depending on your population, depending on the availability of your vaccines, you can actually allow pregnant women, and especially those pregnant healthcare workers or those in high-risk situations, to consider using the vaccine in pregnancy. But unfortunately, the scientific data, we're still waiting on the publications to have a more liberal use of it in pregnancy. A lot is actually being published with the mRNA vaccines. So we are actually hoping that when and if they arrive on our shores, we can look at this with the National Immunization Technical Advisory Group and consider it.
Okay.
Thank you very much, Mr. Alexander.
Thank you very much, Dr. Surjit Singh, and I'd also like to thank the public for these questions. As we move into the question and answer segment of this conference, we remind our media representatives to indicate their name and the name of the media house that they represent before posing the two brief questions. Kindly indicate to which presenter each of your questions you would want to pose. If time permits, as usual, we will field an additional question from each media representative. We will start our question and answer with TTT. Good morning.
Hi, good morning all. Sonal Lala from TTT News. Question to Ms. Abdul, Dr. Abdul Richards. We know the AstraZeneca rollout starts today. How has applications for appointments gone so far based on that rollout of the AstraZeneca? Have you seen an overwhelming response, people applying online? And if so, do you think people were waiting to get an option or a preference to being jabbed with the AstraZeneca? And secondly, I'm not sure if you could give us an update on, I know the Prime Minister would have indicated last month that of the possibility of us receiving some sort of allocation of Pfizer vaccines from the US. Any update on that, whether this donation would be received anytime this month?
Thank you very much. So firstly, I would like to thank the population for their high levels of vaccine acceptance subsequent to the Honourable Minister's announcement of the donation of 82,500 AstraZeneca vaccines. The Ministry of Health and the Ministry of Public Administration has, of course, set up a call centre which has been operational. And we have received a high level of vaccine acceptance and a high volume of calls, which suggest that persons are very interested in obtaining the AstraZeneca vaccine. As of 3 p.m. yesterday, there were 5,400 appointments that were made, 4,600 online and 762 at the call centres. This response is again quite heartening given the Ministry of Health's targets for vaccinations. Your second question revolved around an estimated delivery date for vaccines that have been donated or planned to be donated from the United States. The Honourable Prime Minister and the Honourable Minister of Health will make a subsequent announcement on this date once it is confirmed and once a plan is confirmed. So thank you very much.
Thank you very much. And we now move to AZP. AZP News, good morning.
Hi, good morning. This is Suan Wayo from azpnews.com. I don't know if this question may be able to be answered today, but we were made aware of sentinel physicians, which those who are allowed to administer the COVID-19 vaccines at homes. Can more information be given in terms of allocation procedure, how many doctors have been chosen, etc.? Thank you. As well as to Dr. Adesh, can you tell us about pregnant women who have COVID-19? What special care measures are in place for such? Thank you.
Thank you very much, Suan. So as part of the national response to COVID-19 and as a measure of increasing the vaccine uptake and vaccine rollout, the Ministry of Health is currently partnering with sentinel physicians based on Ministry of Health policy and previous history in terms of immunization. At present, we have engaged a number of sentinel physicians with an allocation. However, as of this time, I can't provide the actual number. However, it's a question that you can forward to the Corporate Communications Department, and we will provide you with an up-to-date number of sentinel physicians. That is because we have physicians being added on a daily basis, and because we are adding sentinel physicians now on a phased basis based on the availability and accessibility of vaccines. Thank you very much.
Thank you. Second question to Dr. Sujit.
Yeah, thank you, Suan, for the question. So what we did at all our maternal and newborn centers was set up inside of those centers. For example, if you use the Mount Hope Women's Hospital, for example, you actually have a parallel system within the existing hospital framework. Because we simply could not recreate maternal and newborn units at the parallel healthcare system. So it's much and far more safer to have your experienced staff and all the facilities there on site in one facility, which is fully equipped to deal with it. So what we did was create these isolation areas at the hospitals where if a patient who tests positive for COVID-19 or is displaying symptoms, generally they are stabilized depending on what status they are. Some may be in early pregnancy and may not need care at the maternity unit. So we'll coordinate with the county medical officers of health. We'll coordinate with Dr. Trotman and her staff if they need to be hospitalized within Cora, Couva, Augustus Long, any of those major centers. If they need obstetric care services, however, they will be admitted and they will be delivered. And if necessary, they will be transferred afterwards. Babies as well are also being cared in our neonatal care units if they need any facilities. But so far, we have not had that. They've really been observation and follow-up. Thank you.
Thank you very much, Dr. Surju Singh. We now move to 103 FM. 103, good morning. Okay, seems we will just move and we'll get back to 103 FM. So we move to TV6.
Shay from TV6 here. My two questions actually. First two questions are for Dr. Surju Singh. Dr. Surju Singh, you said many breastfeeding women have so far, taken the opportunity to get the vaccine. I was wondering if you have figures for how many breastfeeding women have had their first and their second dose of the vaccine, how many are fully vaccinated. And in addition, you would have stated that preterm pregnancy is a risk to a COVID-19 positive mother. From the data we've collected so far, have we had the preterm pregnancies? How far preterm are we talking about? And have we had any miscarriages? Thank you.
Right. Okay, thank you for those questions. With respect to the first one with the data, so we actually do collect the data along with with our team in the expanded program of immunization. However, I don't actually have the figures at hand to share with you, and we can share that at a later time. But they are of the order of several hundred. In terms of preterm delivery, the answer is yes. Preterm delivery, for our consideration, we will suggest anything above 26 weeks of gestation, a pregnancy being 40 weeks. These are babies which we consider salvageable. We haven't seen any increased risk of miscarriages, which would be before 26 weeks. And we have seen an increased incidence. In fact, right now, our intensive care neonatal units are actually at a peak at all of the centers, some of which may be related to the COVID cases as well. So it is becoming a bit of a challenge at that level. Thank you.
Thank you very much, Dr. Surju Singh. We now move to the Express for your two questions.
Hi, good morning, everyone. Kay Marie Fletcher, Trinidad Express. My first question would be for Dr. Surju Singh. Seeing that, unfortunately, we had a death of a mother, and then we had the transfer of mother to child with COVID, is it now that you would be encouraging pregnant women to definitely go to get the vaccine? Of course, we're encouraging everyone, but is there, extra focus being placed on women to get the Sinopharm vaccine? And is it now probably an encouragement to get the AstraZeneca vaccine as it's back on stream to encourage persons who may want to have a choice? And my second question would be for Dr. Richards. Seeing that we have more sectors being reopened today and also next week, the retail sector, which brings thousands more persons back on stream, is the government now considering a policy on mandatory vaccines? What's the ministry's position in recommending that to the government? Thank you.
So I'll take the first question.
Yes, please.
Okay, so thank you for that very good question as always. So as the scientific data continues to evolve, we take all of the information and we will review it as always. It depends on, of course, the number of cases that are occurring, the incidence, how often it's happening in terms of affecting our population. So at this time, all we have done is, at the Directorate of Women's Health, we are the technical experts. We have provided all of the relevant scientific documentation to another group of experts, which is the National Immunization Technical Advisory Group. They are the ones who would consider all of the data with respect to whether we can allow vaccination in pregnancy. Now, unfortunately, you would have to appreciate that the vaccines you have named, which are Sinopharm and AstraZeneca, there's still relatively limited data when it comes to use in the pregnant woman. There's much more data after you've delivered with breastfeeding, and that's where the recommendation for Sinopharm came upon. Now, as I said before, we do have a large study that's ongoing with respect to the mRNA type vaccines, which is the Pfizer brand, and we are hoping that with the promising results that we are seeing, that if it arrives on the shores, we should consider this at that group, whether we can use it in that population. Thank you.
Thank you.
Thank you very much for this very topical question regarding vaccinations. The government of Trinidad and Tobago has recognized that vaccinations are really a multi-sectoral response and that it requires the cooperation of members of the public. The Ministry of Health has done all it's in its part through the parallel healthcare system and through the vaccine rollout program to ensure that persons can receive vaccines at several sites nationally. Vaccines are now safe, they are now very accessible and available for all persons that qualify in our population. Therefore, the Ministry of Health continues to encourage persons to practice social and personal responsibility, especially as sectors continue to open and we attempt to return to a sense of normalcy. Of course, with increasing movement of persons and an increased risk of commingling, the persons and the population is asked to adhere to the 3 Ws, which are public health prevention measures, with vaccination as an additional layer of protection. Regarding the policies for mandatory vaccinations, this is a policy that has to be reviewed and is really under the purview of the Cabinet and the Honorable Prime Minister. At present, vaccinations are voluntary, and we would really appreciate all your support in obtaining herd immunity and meeting our targets. Thank you.
Thank you very much, Dr. Surjit Singh and Dr. Richards. We now go to Power 102 for your questions.
Good morning, Sparkle McIntosh, Power 102 Digital. My question is directed at Dr. Abdul Richards. Though I feel that I would have had part of my question explained previously, I will still pose my question. Dr. Abdul Richards, you made mention that there is a greater sense of vaccine acceptance among the population right now. However, previously, the health minister stated that there was a slowing down in the momentum of persons going out to get vaccinated. Does the Ministry of Health have a plan to rejuvenate its vaccination campaign across both islands, Trinidad and Tobago? And this could be inclusive of Swasian.
The Ministry of Health. Thank you very much, Sparkle, for that question. The Ministry of Health continues to have communication plans, to have outreach activities, health education activities and health promotion activities at our health centers and facilities and across all forms of media. We have also partnered with the private sector for Ministry of Health approved messages to really highlight to the population the safety, effectiveness, availability and accessibility of vaccines. Yes, we have noticed an increased acceptance over the past few days, and of course we would like to recognize and thank the population on this. And I'd really like to confirm and to reiterate to members of the population that the communication strategy that is in place with the ministry and other stakeholders is continuously being assessed and based on feedback from our population and other members. So it's an ongoing, iterative process meant to really understand the needs, the myths, the misconceptions, and to really relay the correct information to our population. Thank you.
And thank you, Dr. Richards. We now go to the Newsday for your 2 questions.
Good morning. Hi, morning. Good Chantak of Newsday. My 2 questions are to Dr. Richards. Firstly, could we get an idea as to where the state, what's going on with respect to those prisoners from Carrera who tested positive for COVID and about other moves to vaccinate other prisoners within the system against the virus? And secondly, I wanted to ask as well to Dr. Richards, given what we're trying to achieve with vaccination and all the various methods that we're doing and strategies and so on, how badly would the arrival of the Delta variant in TNT derail all of that if we don't meet our targets and if it still gets here with a significant number of the population unvaccinated?
Thank you very much, Clint. Your first question was an inquiry about the increased number of cases out of the Carrera prison. I would like to suggest that this question be directed to the Ministry of National Security, under whom the Trinidad and Tobago Prison Services falls. They, of course, have their discrete medical department that is supported and collaborated with the Ministry of Health, but they will be able to provide a much more in-depth answer, and also as per protocol across ministries. Your second question, of course, is very topical, and it was about the arrival of the Delta variant. Of course, we know that this variant is present in several countries in our region, and the CMO and the Honorable Minister would have spoken about the R0 and the increased infectivity and transmissibility of this variant. The Ministry of Health continues to do all in our power to ensure the quality care of persons, and we have been trying to implement, and we have activated additional ICU beds across the parallel healthcare system. This is being done on a phased basis, and we are ensuring that all the beds have the appropriate staffing levels, the appropriate supporting equipment to manage any patients who are critically ill. However, the onus is on the population to please ensure social and personal responsibility, because vaccination offers a protection against the COVID-19 virus and additional variants. Thank you very much.
Thanks again, Dr. Richards. 103 FM, we're coming back to you for your two questions.
Hello, are you hearing me? Good morning. Hello? Morning.
Please.
Good morning.
Morning, we are hearing you. Thank you.
Good morning, are you hearing me?
Okay, so we will come back to 103 FM. We go to Guardian Media Limited.
Good morning, to the panel. Good morning, Dr. Richards. My two questions are for you. In terms of, can you say, given the overwhelming response for the AstraZeneca vaccine today, can you say what mechanisms are in place to prevent persons who may have had their first shot of the Sinopharm or even fully vaccinated with that particular vaccine from coming back into the system to be vaccinated with the AstraZeneca vaccine, given the wide acceptance in terms of international travel? That is the first question. And secondly, can you say whether or not any samples that have been submitted to UE for testing of the Delta variant have so far confirmed its presence in TNT? And if not, how soon can we expect to see results of some of those samples coming back? Thank you.
Thank you very much.
Thank you very much. Let me take the first question, which of course is very topical in terms of the testing of the Delta variant. As of today, there are no confirmed cases of COVID-19 due to the Delta variant. However, the Ministry of Health, and in conjunction with the University of the West Indies, in a team led by Dr. Christine Carrington, who makes appearances with us at the media conferences, does have a protocol in place for testing for the Delta variant. At this point in time, as I indicated, there are no cases of the Delta variant, but we have put in place mechanisms to test persons who may be considered at high risk of transmitting the Delta variant. This testing is done on a continuous basis, and so once a result that is suspicious or a Delta variant result is confirmed, the Chief Medical Officer and the Honorable Minister and others will be immediately informed, and this information will be shared. Your second question was around persons accessing the AstraZeneca vaccine even though they have had the Sinopharm vaccine and a full dosage of the Sinopharm vaccine. First of all, yet again, we would like to encourage members of the population to be honest in terms of receiving their vaccines at these sites. Secondly, the Ministry of Health does have records at our various sites with the vaccines that would have been administered to persons, and these records are kept not only by the regional health authorities, but also by the expanded program of immunization, which is the department at the Ministry of Health that leads the vaccination drive. We again would like to stress that we do have robust record-keeping mechanisms in place, but we still would like to encourage persons to be honest and to be responsible so that others who may have not had the chance to get the vaccine or the opportunity can obtain it. This is the only way forward as we try to maintain and to achieve herd immunity.
Thank you for your question, Jamel, and the response from Dr. Richards. We have an additional question from TV6. You ready for your question?
Hi, Alicia Boucher from TV6 here again. I guess both Dr. Richards and Dr. Surju Singh can take part of this question. So as of very recently, the WHO approved ivermectin for use in terms of clinical trials. What does this mean for Trinidad and Tobago as a whole? And Dr. Surju Singh, does the ministry have any pronouncements so far as to the use of ivermectin in breastfeeding and pregnant women who may contract COVID-19?
I think I'll take the question. So of course it's very topical. These things are always, in the scientific journals. A lot of the information tends to what we call to be early journal releases, some of which are not peer reviewed. There isn't a larger scientific body of evidence, so it sounds good initially when we see the initial reports, and this holds with a number of other drugs, not only ivermectin. But we are very cautious. We have the health of the nation, the safety of our patients at heart at the end of the day. We're not going to rush on every single thing that you do see coming out in the international press or the media. So we do have scientific teams looking at all of the information. It's a 24-hour basis this is going on. And as always, we tend to be guided by the World Health Organization to assist us in those determinations. So I hope that answers your question.
Thank you very much. We will try 103 FM just one more time. 103 FM.
Good morning, everyone. Sira Chandu from 103 FM. I apologize for the difficulties before. My two questions. First of all, with regard to reinfections, do we have figures for how many people may have been reinfected with COVID-19, or even how many times a person may have been reinfected? And my second question, IL-6 receptor blockers were approved on July.
We will just take the first question. We do apologize. Would you be able to take the first question?
Yes. Thank you very much, Sarah. Really appreciate your question, given the technical difficulties. As far as reinfection rates are concerned, this information is collated by the Ministry of Health and the Epidemiology Department. At this point, I don't have those exact figures, but you can refer them to the Ministry of Health, and the Epidemiology Department would be prepared to give an accurate and up-to-date number. Thank you very much.
And our final question goes to Power 102. You're able to take a follow-up question. Power 102,
good morning. Sparkle McIntosh, Power 102 Digital again. My question is for Dr. Abdul Richards on the topic of mixing vaccines. Now, I know you spoke about the Ministry of Health having a record of all persons who would have taken the Sinopharm vaccine. But because there is so much talk in the public domain about the mixing of vaccines as it relates to travel and the sovereignty of other countries, what mechanisms would the ministry put in place to somewhat curb persons who would now opt to take the AstraZeneca vaccine after having taken one dose of the Sinopharm vaccine?
Thank you very much, Sparkle. Again, another very topical and interesting question. The Ministry of Health issued a press release based on the World Health Organization recommendations and guidelines on the approved mixed vaccine combinations. This was based on the emergency use license and based on data that has been collected and collated. We, of course, prioritize the safety of our population, and so the CMO would have, and the Ministry of Health would have indicated the relevant policies for the mixing of vaccines. Again, the Ministry of Health does keep records, so we would be able to identify if there is some falsification or false identification with respect to vaccines. Thank you very much.
Thank you, everyone. We have come to the end of today's virtual media conference. Remember the COVID-19 vaccines being distributed by are all WHO approved. They are safe, they are effective, and they are free. Starting today, persons wishing to get the AstraZeneca first dose or the usual Sinopharm second dose can visit the following sites across Trinidad and Tobago: the Paddock at Queen's Park Savannah, Napa Port of Spain, UTT Chaguanas, the National Racquet Center, Tacarigua Sangre Grande Civic Center, Mayaro Regional Sporting Complex, Sapa, that's in San Fernando, the Diwali Nagar site, Atobolian Stadium in Couva. All these sites, and even Tobago, some 4,000 AstraZeneca have been allocated, and the rollout is expected soon, in fact this week. Of course, a call center and online appointment systems are available for the public to book spaces for vaccinations. The call center contact is 800 VACC, 800 VAC, and it's open from 7 a.m. to 7 p.m. and online appointments can be made via www.ttvaccine.com. That's www.tt, as in Trinidad and Tobago, vaccine.com. While walk-ins will be accommodated at all sites, the sites just mentioned, priority will be given to people with appointments. So go, grab your jab. Do it for you, your family, friends, and country. Let's all do our part, and let's vaccinate TNT. Stay tuned for 2 very interesting videos. But goodbye for now.